Dear ladies and gentlemen, I'm very proud to present you the results of a master thesis of my PhD student Benjamin Rödiger, who is the co-author of this talk. It's about the benefit of an intense 10-day combined electromyography and visual feedback training on facial gratings in patients with post-paralytic facial synkinesis. The study was supported by the EZKF Jena. As all of you know, synkinesis occur in perhaps 20% to 30% of our patients. So the following study is not about any training for acute ones, nor for chronic denervated, but only for this group here in yellow with the synkinesis. So there's good evidence that patients suffering under synkinesis have a benefit from injection of botulinum toxin and less evidence for facial training or retraining techniques. In Jena we have started to do intense facial palsy training for 10 days, 2 weeks in a row, to increase the mobility of the face, reduce synkinesis, and we use a combination of electromyography and visual feedback by cameras. You see here our setting. The therapist on the left side, the patients in the background on the right, and a laptop and a screen with a camera in front of the patient or in the front of the therapist. If you look closer on the screen, you see the video of the patient and, also very important, the EMG activity from the left side and from the right side, recorded by surface EMG and visualized in columns and in numbers. So this helps the patient very much to get into the state of relaxation, to go really down with his tone and to go on both sides on an equal tone. In addition to this intense training, what happens every day for around 3 hours under the guidance of a therapist, the patient is asked to repeat this training with a mirror in the afternoon, kind of home training, but in the beginning the patient was sleeping in our hospital. At the moment they mostly go to hospitals or into an hotel. So this home training is self-guided in contrast to the therapist-guided stuff. So around 5 hours of training per day for 10 days in a row in 2 weeks. For this study we were not interested in the patient-related outcome measures or in electrophysiological outcomes, but in the visual experience graded with the standard tools. We were interested to use the Haus-Bregmann, the standard Parese index, mostly famous in Germany, the facial nerve grading system 2.0, and the Sunnybrook. You know most of things, so I don't go into detail here. The aim of the study was to show the effect of the training, but also which grading system can show the effects of the training. Is there one better than the other? Does the age or the sex of the patient or the duration of the palsy have an effect on the training? And is the effect of the training stable over months? So in the study we included 54 patients with synkinesis. The etiology is listed up here. They were treated in our ENT department from 2013 to 2016. 2/3 of them were female, or over 2/3 of them, 77% were female, and the mean age was 48 years. From all patients, we took standardized photo series to 4 time points. One, when the patient comes first to our outpatient department, this is called T0, so the first contact, when we were talking to him, getting a needle EMG, talking about the therapeutic options. And then a few months later, when the patient got the appointment for the intense training, the T1 at the beginning and the T2 at the end of this 2 weeks period. And then after 6 months, we called in these patients for a follow-up visit to get an idea how well the training lasts, how happy the patient is at it. Very important, these pictures were taken in a very standardized way by a professional photographer. In the meantime, we have extended this from this 9 pictures to 12 pictures, but there are publications about our extension. So in total, from the 54 patients, we had 213 pictures. From 3 patients, the T0 was missing, and the PhD student Benjamin Rödiger was retrospectively blinded rating these photo series using all 4 grading systems in a randomized order. So now coming to the results. Which grading system can show the effect of the training? So now we are interested from the T1 to T2, before to after the training, directly after the training. And we have seen significant improvements in all gradings. So first, here's the standard index, House-Bregman, facial nerve grading system 2.0, and the Sunnybrook. And these 3 stars indicate that is the Wilcoxon test significant, and even more important, the Cohen's D showed strong effects only with this more sensitive grading system, the Sunnybrook, and the facial nerve grading system 2.0. If we go a little bit more into detail and go look for the sub-scores, there was a significant improvement of the movement of the face, but also of the synkinesis, but not of the resting tone. That's interesting, because this was also what we were trying to reach. Of course, we were also trying to outbalance the asymmetric tone, but mostly we were focused on movement and synkinesis, and that fits to our results. Here I show you some pictures from one patient before the training, when she was poking her lips. Her eye was closing, very typical for synkinesis. And after the training, 2 weeks later, she was able to poke her lips without accidentally closing the eye. If you look very close, you see that she's perhaps not as strong forcing the lip poking as before, but yeah, it helps and makes her more symmetrical. And here comes the second example. A patient before the training, and here by trying to pull down the corners of her mouth, and her eyes closing very strong. And after the training, she was able to pull down the corner of the mouth without the synkinesis. So just 2 examples. Then we were looking if there's a correlation between the age, the sex, or the duration of the palsy, and we found non-correlation, so it seems to work even with long-standing defects. Also, no effect of the younger or older patients had a benefit from it. So it seems to work for both sex and all age. last question I want to answer here is how long is the effect stable? So at the moment we only call the patient in after 6 months. So now it's interesting to compare T2 with T3. And there's no change after 3 months. So the effect seems to be stable. All 3 grading systems showed more or less the same effects. No big improvement or reduction. What is pretty good. So it's not only a short-term effect, the patient was able to keep the success, to take it home, and sometimes even increase it. Results of the study. The answered question: all facial grading systems can show the effect of our training, but the Sunnybrook and the facial nerve grading system should be preferred. They go more into details, and they're internationally used, and the effect size is best here. There seems to be no influence of the age or the sex of the patients or the duration of the palsy, so even long-standing patients can benefit from our training, and at least for 6 months the effect is stable, what is great for our patients and for us. Thank you very much for your attention. I am open for discussion now, but want to use the time for a short announcement. There's a special issue in the journal Diagnostics. It's about evidence-based diagnostic and management of facial nerve disorders, and we were able to extend the deadline for a few weeks. So now it's end of June, 30th of June here, and all participants get a discount. So if you put the Facial Nerve Symposium 2022 in, you get a 20% discount for your publication, open access publication fee. Thank you very much for your time, and I'm happy that we can meet at least online here on this Congress.